Okay, this is part two of some videos I was making about surgery and anesthesia, general anesthesia, and the risk of brain damage, because it's much more common than as people realize. I did a surgical internship, and patients, they would consent in 5 seconds for open heart surgery, for craniotomy. They thought it was no big deal. Sure, I'll get the surgery. You know, I'm just like, are you sure? Here's one paper from JAMA, Journal of the American Medical Association, showing that in patients who went non-cardiac surgery, the risk of stroke is higher in cardiac surgery, you know, because you're working up in the chest, potential for emboli, you know, atherosclerotic plaque breaking off and going to the brain, or air bubble. But anyways, even just in general surgery, non-cardiac surgery, the risk of stroke was 7% in older patients. And it's a big sample set out of over 1,000 patients. And of course, there's increased risk of postoperative delirium and long-term cognitive defects. So, especially in people over 65, man, you better take it real seriously. 10% developing long-term cognitive decline after non-cardiac surgery. Okay. So that should be factored into your consent. You know, do you really want to take this risk? Here's another paper, lasting effects of general anesthetics on the brain in the young and the elderly. Increased risk in very young, like less than 2 years old, and in the very old, you know, people over 65, so to speak. I'm close to that, but I'm healthy for my age, you know. And what they found was these general anesthetics will cause mitochondrial apoptosis. The typical patient in my experience, and I was an imaging-guided surgeon before I became a neuroradiologist, before I became a nutrition doc, and patients would routinely say, I don't want to remember everything, I want to be knocked out. I want to be knocked out. Give me the maximum anesthesia to knock me out. And I'm like, no, you don't. If I can do this with local anesthetic, I'll do it with local anesthetic. But they would want, because they, you know, to me, it's obvious. If you turn off the brain for general anesthesia, how certain are you that you can turn it back on correctly? Why do you take that for granted? I wouldn't take that for granted. Okay, so look what this article says. It has long been held as an illusory concept that general anesthesia is entirely reversible and that the central nervous system is returned to its pristine state once the anesthetic agent is eliminated from the active site. However, studies indicate that perturbation of the normal functioning of these targets may result in long-lasting, undesirable effects. Okay, so here's what I find funny. This article is written by a bunch of Chinese guys, okay? So these Chinese guys are telling the truth. All right, I mean, anesthesia, general anesthesia is dangerous. Don't get me wrong, the stroke could be due to surgery, the stroke could be due to the anesthesia, but anesthesia intrinsically, in and of itself, is dangerous, general anesthesia. Very routinely, it's a mitochondrial inhibitor. And one of the side effects is mitochondrial apoptosis, meaning cell death due to mitochondrial injury. One of the things it can do, it can open up what are called IP3 channels, the receptors on the endoplasmic reticulum, which release calcium into the cytoplasm. I'll show you on the next slide a diagram of that. So here's the general anesthetic. It comes into the cell and it opens up these IP3 channels on the endoplasmic reticulum. Okay, and that will then release calcium into the cytoplasm, and in such large amounts that it'll flood the mitochondria. The mitochondria becomes overwhelmed, the cell dies, goes into programmed cell death, apoptosis. Okay. And by the way, all this stuff about localized calcium channels, you know, there's the plasma membrane calcium channels, there's the endoplasmic reticulum calcium channels, there's the entry of calcium into the mitochondria. What I think is going on is the water has 4 phases. Everybody knows 3 phases, liquid, gas, and solid, ice. But it has a 4th phase, a gel phase. And my understanding of the physiology, this is pretty cutting edge, state of the art. It's not yet proven, but I've seen some articles that suggest this, and it makes sense from everything else to do with microdomains, is that the localized concentrations of calcium are fluidizing parts of the cell, making them more active and facilitating upregulation of some enzymes, as well as some enzymes like ATP synthase on the inner mitochondrial membrane to run faster. So that's pretty interesting stuff, and that's why you might want secondary calcium releases into specific microdomains within a cell so they can control what parts of the cell are active or inactive. It's a brilliant way to turn on and off different parts of the cell. All right, so anyways, general anesthesia is very dangerous. Don't get me wrong, if you have a major surgery, you might need it. It could save your life. But you don't want to just go, you know, lollygagging into it. Oh, heck, I had more articles. I got more slides. There's got to be more. Is that all I got? Okay, here's what I was thinking of. This is the one I had wanted to start with. All right, cognitive dysfunction after cardiac surgery. The hippocampus in particular, the early memory center, the thumb drive, if you will, in the brain, in the medial temporal lobe, which stores early onset declarative memories, factual things that you could say. It's very vulnerable to ischemia. So you have pump head, prolonged hypotension post-op, from anesthesia, intraoperative hypotension. It's vulnerable. It's vulnerable to being severely damaged. After cardiac surgery, they're quoting a ballpark of about 40% of the patients have a new stroke on their DWI, diffusion-weighted imaging. That's the MRI sequence of the brain that shows strokes. So this is a cardiac surgery journal. You know they're going to give you the lowest possible numbers. They want to make the surgery look good. And based on them wanting to make the surgery look good but still being willing to tell the truth, they're telling you a 40% stroke rate post-op after cardiac surgery. That's pretty high. It's going to be worse after valve surgery than after just coronary artery bypass surgery, CABG, CABG, okay? But still, that's high. 30% of the patients cognitively impaired at 2-month follow-up, 2 months out. That's a lot, 30%. So think about it. If you're talking, now it's probably a little higher, and again, valve surgery rather than CABG, open heart, coronary artery, bypass surgery. But still, let's say it's 25%, even 20%. Factor that into the risk-benefit ratio when you consent the patient. You got 100% cure of coronary artery disease with a low-fat vegan diet with 0 side effects except good ones, optimization of body weight, diminishment of hypertension and diabetes, and 0 cost. Or do you want to spend $200,000 for surgery that doesn't increase your longevity and has a 30% cognitive impairment rate? Well, let's call it 20% cognitive impairment rate, okay? It has a stroke rate of 40, whether or not they're symptomatic. 40% of patients got a new stroke lesion on their brain MRI, okay? That's bad, okay? And they quote in symptomatic stroke 2 to 5%. They're quoting encephalopathy 10 to 30%. Oh, if they're saying the incidence of cognitive dysfunction, 30% at 2 months. Okay, those are big numbers. So, I mean, think about that. That's a lot. And, again, it's not necessarily all from the anesthesia or from the surgery, but they're both dangerous. The surgery is dangerous and the anesthesia is dangerous. So don't get me wrong. Some patients need it, but this should be part of the idea, because I try to tell a patient about the low-fat vegan diet. They get pissed off. They get annoyed. They don't want to hear it. They think it's nonsense. They roll their eyes like I'm a goof or a jerk or stupid. But you tell them, surgery. They're like, yeah, I need surgery. I need surgery. I just want the surgery. Because they don't want responsibility. They don't want to change their behavior. But they pass up the thing that really works. Anyways, I thought that was a little interesting. Hope you found that interesting.